According to the CDC, there have been 35 reported cases of Zika virus in the U.S., including one here in Minnesota. That, in part, forced the World Health Organization to declare a global health emergency. The concern over Zika virus this week led to at least one Olympic athlete saying that she might not compete in Brazil this summer.
Cases continue to rise there and here in the U.S. Concerns about the virus are on the rise with spring break right around the corner, and that's why we have joining us this morning, or this noon, I should say, Dr. Nila Suntharam from Park Nicollet, who specializes in infectious disease. Thank you so much for joining us.
Sure.
So this is a big concern for pregnant women. How serious of a threat should people take it?
Well, the Centers for Disease Control has recommended that a woman in any stage of pregnancy should avoid traveling to countries where there is active Zika virus at this time. And there are numerous countries that the CDC lists on their website, and they are countries in Central America, South America, and the Caribbean.
And so you listed those countries. You know, it's that time of year, especially here in Minnesota, where people are planning their spring break trips. A lot of people might have trips planned to Jamaica or the Dominican Republic.
Right.
Should they think about canceling those trips?
Well, if you are a pregnant woman, the recommendations are not to travel if you can avoid it. And that's been recommended by the CDC. We don't know enough about Zika virus to know exactly when the transmission is occurring. So to be on the safe side, if you're pregnant, the recommendation is not to go. Now, if for everybody else, the majority of people who may contract Zika don't have symptoms. That's about 80% of people. The other 20% may have mild symptoms such as fevers, joint aches, rash, and sometimes red eyes or conjunctivitis. Serious complications can include something called Guillain-Barré, which is a neurologic illness that can lead to weakness and sometimes rarely paralysis. But again, most people don't have any symptoms at all. And as far as we know at this time, it's a limited illness. You'll become ill within a week after being infected, and generally symptoms get better in the next week or so.
Is there a concern, though, of people who do go to these affected areas, and if they were to become infected, come back here to the United States and transmit the disease? And if so, what can they do to protect themselves?
If you are traveling to countries with Zika, the best protection would be to protect yourself from mosquitoes. So using mosquito repellent, such as DEET. If you're in a room, try to see if it could be air conditioned. Try to use mosquito nets. These mosquitoes that transmit Zika bite throughout the day, so you have to be cautious all the time. You know, you can wear clothing that is long sleeves, you know, long pants. You're going to be in hot climates, but you know, these are things that you can do to try to avoid being bitten.
Well, I guess the biggest thing is just make sure everyone is educating themselves about the virus. So, Dr. Suntharam, thank you so much for joining us this noon.